Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. Greetings of peace, everyone. So, for this video, we will have our first discussion for the course Health Assessment. So, this video talks about the Module 1 of our subject. So, this talks about the nurse's role in health assessment and the nursing process. So, let's start our discussion by having a brief description of the courses and the grading system for this course. So, this course or the course health assessment deals with concepts, principles, and techniques of history taking using various tools, physical examination or head-to-toe or cephalocaudal assessment, psychosocial assessment, and interpretation of laboratory findings to arrive at a nursing diagnosis on the client across the lifespan in community and hospital settings. Students are expected to differentiate normal from abnormal assessment findings and utilize the concepts, principles, techniques, and appropriate assessment tools in the assessment of individual client with varying age, group, and development. Now, this is my references. If you wish to have a copy, you can just look for it in the internet so that you can have your ebooks. No? So we have here your Kazir and Herbs, Fundamentals of Nursing, 10th edition, the Weber for Health Assessment in Nursing, and Walter's Kluwer for Health Assessment Made Incredibly Visual, 2nd edition. Now, for your grading system, for major exams, we have 40% and your quizzes. So every module we do have quizzes or activities or assignments given. So it is 60%, a total of 100%. Now, let's talk about the nurse's role in health assessment. So, nurses play a crucial role in health assessment by systematically collecting and analyzing data to understand a patient's current health status and identify the needs. This process involves gathering a health history, performing a physical examination, and using clinical judgment to interpret things or findings, leading to the development of appropriate nursing interventions and care plans. So the key roles of the nurses in health assessment includes: first, we are responsible of collecting a comprehensive health data about our patient. After we collect that comprehensive health data, we will now proceed in having or performing your head-to-toe assessment or your physical examination. Now, during the physical examination, you will identify the normal and abnormal findings. This is why we need a good established and good foundation of anatomy and physiology. Because in order for you to differentiate the normal and abnormal, you have to know first what are the normal findings or normal functions ng ating body. Okay. So after identifying during your head-to-toe assessment, you identify normal and abnormal findings. Now, upon finishing the head-to-toe assessment, you will now analyze the data that you have gathered through interview and through physical examination. You will now identify any health risk that is present in your patient. After you identify those health risks, you will now have the understanding about the case of your patient. Now, you're capable of providing nursing diagnosis. Not only the doctors will have their own diagnosis, but also as nurses, we do have our own nursing diagnosis. Now, the difference between the nursing diagnosis and doctor's diagnosis, the doctor's diagnosis focuses on the illness or disease of the patient, while as nurses focuses their diagnosis on the status of the patient, on the needs of the patient. Okay, so that's a big difference. Okay, and then having your nursing diagnosis, you will now have your nursing care plans in which you will now provide interventions that would allow the patient to improve their well being. So, another role of nurses in health assessment is that you are an advocate of the patient's safety. You have to identify any urgent health concerns you requiring immediate intervention. So, the importance of nurses' role in health assessment. So, this health assessment enables nurses to detect health problems early, to establish a baseline for future comparisons, prioritize patients' needs, support accurate nursing diagnosis, and to improve patient safety and clinical decision making. So, in order for you to do those different roles, we have to understand first the foundation of health assessment, or the foundation of what they call this, of nursing, which is your nursing process. Now, actually, health assessment is the foundation of your nursing process. Before you before you perform, or before you will have your analyses, before you will have your planning of care, before implementing care and evaluating the care of your patient, or care that you have rendered to your patient, you have to understand first, or you have to gather the good health assessment. That's why we have to learn this one in order for you to practice nursing process in the future. So nursing or health assessment actually is the foundation of nursing process. Through comprehensive data collection, physical examination, we will have, or we are now capable of identifying the health needs of the patient. So what is a nursing process? Why do we need, or why is it important? So here are the reasons why nursing process is implemented and known to be the foundation of the nursing. So actually, nursing process is the systematical way or systematical method of organizing ideas and understanding the needs of the patient. So first reason why do we implement, or why do we use nursing process in having our they call this interventions, or in establishing one of the good relationship with our patient, no? So first reason is the nursing process allows us to identify a client's health status. As I said earlier, through your first phase of your nursing process called assessment, you will have, or you will now capable of identifying the client's health status. Another, you are capable of establishing plans to meet the identified needs. So you will now have your short-term goals, long-term goals for the benefit of your patient. And then deliver specific nursing intervention. Take note of the word specific, because every nursing care plan or nursing intervention is individualized. If patient A and B has hypertension, the needs of the patient may differ. That's why the interventions that you can give for those patients may be different, because again, our interventions, our plan of care is focused on the needs of the patient. Now, the patient A who has hypertension may need a, they call this, pain reliever, or patient B may need or would want rest. So they do have different needs because we're individual. So what are the different phases of this nursing process? So we have here the mnemonics add pi. So do not forget the mnemonics add pi. So this is chronologically in order, so you have to follow. That's why it is systematically. You cannot go to the next step, or you cannot go to the next phase if you haven't finished the previous phase. You have to finish the first phase so that you can proceed to the second, the third, the fourth, and the last phase. So we have here assessment, diagnosis, planning, implementation, and evaluation. So let's start first with your assessment. Okay. So assessment is the process of collecting data, validating, and recording data about a client's health history and health status. Okay? So, it is the first step of the nursing process. Okay, so this again, this includes the collecting of data, validating the data, organizing the data, categorizing or identifying patterns in the data, making initial reference or inference or impressions, and recording and reporting data. So in this phase, data is gathered through different methods. So it may be through your observation. So with the use of your senses, you will identify the patient, okay? Through interview process. So through interview, actually, you can get subjective data. Anything that is verbalized by the patient is your subjective data. And you can only get that through interview. So you can interview the patient itself, their family, their friends, or anyone who is present in the hospital or during the admission of the patient and who can give you enough knowledge about or information about the patient, then you can have that one. Now, another is through examination or examining. Now, what is this examining? Through your head-to-toe assessment. Okay. Now, during this phase actually of assessment, you can gather two types of data. So, there are two types of data that we can gather through the process of health assessment or assessment. So, we have the subjective data and the objective data. Now, subjective data, or also known as your covert data, These are data from the client's point of view. So this includes feelings, perceptions, and their concern. The method of collecting subjective data is through or primarily through the interview. Now, this type of data is only validated by the patient. Okay. Now, if you had gathered data coming from their friends, their family, now that is not a primary source of your subjective data. Okay, so that is a type of another data, okay, that is or that came from another subjective data of other people. Okay, so this example here, we have here health habits, no? Only the patient can provide you that. Their name, their sex, their address, their age, their chief complaints, their history of present illness. These are just example of those data that you can gather from your patient through interview. Another is we have your history of past illness, their family history with the genogram, their patient's perception. Okay, so that is your subjective data. Now, let's go to your objective data, or also known as your overt data. Okay, overt, again, subjective, covert, and your objective, overt. Okay, it is a data that can be measured or tested against an accepted standard. So, this type of data is tested or measured against an accepted standard. So this is actually what do you mean by accepted standard? The things that we know that is normal from or normal in a patient or normal in a human adult. Okay, so everything that is accepted as standard or normal, that is this type of data is tested against those standard or normal data. So the primary method of collecting objective data is through physical examination or your head-to-toe assessment, or what we call your cephalocaudal assessment. Now, in performing your physical examination, we have 4 methods for you to properly implement the head-to-toe assessment. We use the inspection, okay, wherein we use our sense of sight to properly inspect the patient. So, what are the things that we do inspect? The texture of the skin, the color, the number of hairs, any lesions, okay, any nodules that can be seen in the naked eye, any observations or anything that we can check from your patient using our sense of sight is your inspection. Then another method is we have your palpation. Now, in palpation, we have two types of palpation, the light palpation and the deep palpation. Now, why do we need to use palpation? Palpation actually is the use of sense of your touch, okay? You will touch your patient, specific areas of the patient, and then you can identify the texture of that area, the size of the organs, okay? The any enlargements in the deep organ. So we use palpation. Another, we have also your percussion, in which percussion is a process in which we directly hit a part of the body to produce sound, and that sound that is produced by the body is assessed. Okay, you will now understand if the sound is dull, if it's hyper resonance, if it's resonance, if it's timpani or flat. So each characteristics of percussion sound have different what do you call this, findings. Okay, and last but not the least is auscultation. With the use of your stethoscope, we listen to the sounds that is produced by the body. So what are the common sounds that are produced by our body? The heart sounds, the lung sounds, the bowel sounds. So vascular sounds. So these are just examples of the sounds that are produced in the body, and we have to identify. So example, we have your lung sound. So we have different lung sounds. We have abnormal and normal. So abnormal may include timpani. We have your crackles. For a normal lung sounds, we have your bronchovesicular, vesicular sounds. Okay, so we have to differentiate those different sounds in order for us to identify if the patient has abnormal or normal findings. So now let's talk about the different sources that we can, different sources wherein we can get our data from. No, so we have your primary source, which is the patient only. The data that came from the patient is our primary, because the best source of your data is your patient. Okay, unless the client is too ill, young, or confused to communicate clearly, then you can get data from other sources, which is we have your secondary source. Now, who are the secondary sources of data? First, we have your family, includes also your friends. Next, we have your medical histories or your past medical records. If we can get your previous medical history or past records or in the hospital, then that is a good basis also of your data. And another is through or within the medical healthcare team. From the doctors, from the nurses, from the med techs, from the midwives and everything. So anyone who is a member of the healthcare team that assists you and take care of you is allowed to be a source of data about your status. Okay? So I hope that we have understood the assessment. So now, after the assessment phase, you have already gathered good data, the subjective data, the objective data. You have now made a good impression or analysis of your patient. We will go to your diagnosis. Now, diagnosis is the interpretation or analysis of data. In this phase, you will identify the health problems of your patient, their risks, and their strengths. So the nurse takes information from the assessment and analyzes the information and identifies problems where patient outcomes can be improved through the use of your nursing intervention. Now, during also this phase, we can now formulate nursing diagnosis statement based on the NANDA book or NANDA standard. So we have your NANDA, North American Nursing Diagnosis. So the nurse takes information from the assessment and analyze the information. Now, if you can see here, we have your ACB. Now, what is ACB stands for? Airway, circulation, and breathing, or ABC, airway, breathing, and circulation. Why do you need these three letters? Because this is based on your how to prioritize the health problems of your patient. If your patient has problems in the airway, you have to prioritize that one first. If the patient, okay, so let's say if the patient has a problem in the airway and has um, uh, breathing and circulation, this is the order how we deal with it. Start with assessing or prioritizing the airway of the patient, because if there's no if there is a blockage or any obstruction in the airway, then this may lead to impeding of oxygen. Okay, then if the patient has a problem, has no problem with airway but has a problem in breathing, then you have to prioritize the breathing. And then we have your circulation. Okay, so there are three parts of nursing diagnosis. Three parts of nursing diagnosis, sorry. So we have here your PES, or the mnemonics PES or PES. So which P stands for your problem. The problem, okay, this first part of the nursing diagnosis, problem, describes the client's health problem or response. And this may require specification such as qualifiers to add or to give additional meaning, such as deficient, impaired, decreased, ineffective, and compromised. So the second part. So now we have identified the patient's problem. So let's say the patient's problem is difficulty of breathing. Now we can use an effective breathing pattern. Okay, that's the problem. Now, the second part of the nursing diagnosis is to identify what is the etiology or the cause of the problem. So this identifies one or more probable cause of the health problems and gives direction to the required nursing therapy. So this is the reason why we are capable of individualizing our nursing care plan, because of identifying the etiology. Again, with the said earlier, the patient can experience both diseases the same. However, the cause may differ. So we have a case of hypertension earlier. Now, first patient, the cause why did her blood pressure increase was due to excessive exercise, due to strenuous activity. Okay, that's why the patient had an episode of increased blood pressure. Now, the other side, the other patient, the patient experienced increased blood pressure due to forgotten pill, because he or she was a hypertensive patient. So the two had the same symptom, which is increased blood pressure. However, the cause of the increased blood pressure is different. So, by identifying the etiology of the patient's problem, we can now give an individualized care to your patient. So, after your etiology, the last part of your nursing diagnosis is the signs and symptoms. This is a defining characteristic of your nursing diagnosis, or what was the signs and symptoms that was observed from the patient that would really support the health problem of your patient. So the phrase "as evidenced by" is joined by the two first parts. So example, we have here different examples, okay? So example, the first part, ineffective airway clearance or deficient knowledge or spiritual distress. This is the problem. Now, the second part, this may include, okay? So, when we include the etiology, we use the term related to, okay? So, ineffective airway clearance related to retained secretion. Okay, we'll now know that because of the retained secretion, it caused a ineffective airway clearance. Another ineffective airway clearance related to retained secretion as evidenced by nasal flaring. So that was your evidence. That was the signs and symptoms that supported the problem. So another example, we have your deficient knowledge related to misinterpretation of information. How did you know that there there has been a misinterpretation of information because of, as evidenced by, inaccurate return demonstration. So another example, we have spiritual distress related to separation from religious ties, as evidenced by crying and withdrawal. So these are just examples of your diagnosis. If you wish to have an idea about the different nursing diagnosis that is accepted, you can browse actually a Nanda book or a packet guide for nurses, which includes all of the standards or they call this allowed nursing diagnosis by the Nanda. Okay, so next, let's talk about the different types of nursing diagnosis that we can use when giving diagnosis to our patient. So we have actually six types. So we have the actual, the risk, the wellness, the possible, the syndrome. Actually, five. Sorry. Again, we have actual, we have your risk, we have your wellness, we have your possible, and we have your syndrome. So let's start first with your actual nursing diagnosis. Now, actual nursing diagnosis, this includes client's problem that is present at the time of the nursing assessment. That is why called actual nursing care plan. So it is focused on the present health problem during the nursing interaction. Okay, so this includes acute pain related to fracture or ineffective airway clearance related to retained secretion. So any actual problem of the patient, this includes your actual nursing diagnosis. Now, another type of nursing diagnosis is risk, wherein it indicates that a problem does not yet exist but special risk factors are present. So this time, you have asked the patient if there's any problem. So, no, I feel okay, I feel fine, I think there's no problem with me, ganito, so on and so forth. Now, however, you observed some of the ways and practices of the patient known to be risk factors. So, you don't have the actual problem, but you do have your risk factors. Now, we can use this type of nursing diagnosis. So, risk for infection related to chemotherapy treatment, risk for impaired skin integrity related to immobility. So again, risk indicates that a problem does not yet exist, but a special risk factors are present. So let's proceed to your next diagnosis, next type, wellness. Now, wellness indicates the client's expression of a desire to attain a higher level of wellness in some area of function. Actually, we use wellness when the patient is ready to be discharged. So, if the patient is ready to be discharged, now the patient is capable of or preparing him or herself to be back to their community and to perform their previous roles and functions in the community and in their family. So we can use this type of nursing diagnosis. Again, this type of nursing diagnosis indicates that the client's expression of a desire to attain a higher level of wellness in some area of function. So this includes, example, we have readiness for enhanced family coping, or we have potential for enhanced nutrition. So another type of nursing diagnosis is we have your possible. This type of nursing diagnosis is a statement about the health problem that the client might have now, but the nurse doesn't yet have enough information to make an actual diagnosis. So example, when you are in an ER or emergency room setting. So syempre, you have to be fast. You have to be alert in giving assessment to your patient. Now, you don't have the time to really do the thorough head-to-toe assessment. So you only, the only basis of this nursing diagnosis is very few details or information about the patient. So you can use this one if you don't have really a good assessment. So this is actually good. For example lang natin, we have patients who are comatose, patient who are unconscious by the time they have arrived from the hospital, or patients who don't have family members or significant others with them during their they call this during the time they arrive from the hospital. So because of not enough information, we can use this one possible nursing diagnosis. So the last type of nursing diagnosis is the syndrome. So syndrome, it is used when a cluster of nursing diagnoses are often seen together. So we may have different 3 or 2 actual problems. So this is a syndrome, a cluster of problems of the patient. So example, we have rape trauma syndrome related to anxiety about health, potential health problems as manifested by anger, genitourinary discomfort, and sleep pattern disturbances. Now, according also to the different types, we can use this one in order to make our diagnosis and or prioritizing needs. So, in making your nursing diagnosis, you have to check first the actual nursing diagnosis. You have to check if there is any actual problem during the nursing assessment. If there is no actual problem, then we can look for any risk factors that is observed from the patient. Now, let's say, Mom, we don't have any risk factors from the patient. So, it's good. No? So, you check the chart. Maybe the patient is for discharge. So, you can use the wellness diagnosis. Okay. So, now let's proceed to your planning phase. Okay. Now, the planning phase, it is the process of developing, prioritizing a plan of care, and establishing SMART goals. So, what's this mnemonic SMART goals? S stands for your specific. So the goal that you have to be is specific. Okay, it should be measurable. So you have a standard to measure the improvement of the patient. A stands for attainable. You have to plan a care that you can do. So if it's out of your strengths, then you're not allowed to implement that intervention or to plan different interventions as that. Okay? And then it should be realistic. It should not be through imagination. Okay? It should be time bounded. So S, specific, M, measurable, A, attainable, R, realistic, and letter T, time bounded. So it's very, very important that you have the duration of your goal. If it's for short-term or long-term goal. So in order to achieve a desired outcomes. Now, in formulating goals, again, you can use it. You can either identify your short-term goal and your long-term goal. So your short-term goal, it actually starts from hours of assessment to months. Okay, at least less than 3 months. Okay, that is still a short-term goal. Now, long-term goal includes 6 months to years of a goal. Okay, so the long-term goal is actually applicable to chronic diseases, while your short-term goal is applicable to acute diseases. Okay, so you have to select and write nursing intervention. Now, during here in planning phase, you will identify different interventions that can be implemented or that can be given to your patient. Now, in selecting your nursing interventions, we have 3 types of nursing interventions that we could select. So first, we have your independent nursing intervention. So this is very, very important because these are nursing intervention that is solely implemented by the nurses. These are examples of routine nursing care of nurses. Okay, so includes example, we have recording vital signs or taking vital signs, checking or regulating their IV, carry doctor's orders. Okay, carry out doctor's orders. Call this record and report any abnormal and normal findings of the patient. Okay, so this is just example of interventions that doesn't require any order from physician. So another type of nursing intervention is your dependent. So this type of intervention is dependent on the physician's order. Example, giving medications. The medications that we have to give should be based on the doctor's order. Another is we have to giving nutritional diet or what do you call this? Discussing the diet of your patient. You have to get information or you have to get doctor order from the nutritionist before you instruct the patient on what or about their diet. Okay, so another, we have your interdependent. So this nursing intervention, this type of intervention is based all throughout the healthcare team. So what is known to be or instructions from other members of the healthcare team. Okay, so these are the different nursing interventions that you can plan. Okay, you can write down and select when doing your planning phase. So very easy yung planning, no? But actually, it uses your comprehension, it uses your critical thinking when planning things for your patient. But you have to be objective about it, not subjective. Okay? And then we have your intervention or implementation. Implementation. Now, for the implementation phase, it may be the longest phase, okay? Or it may be the shortest phase, depending on the type of implementation and depending on the interventions that we have planned out earlier during planning. They can be shorter or they can be longer. If your goal is short term, then it will be the implementation phase is shorter. If your goal is long term, then the intervention or the implementation of interventions or implementation of plan of care is longer. So professional nurses uses the first 3 steps of the nursing process in order to provide an excellent, thoughtful, and purposeful nursing care. So the 4th phase of the nursing process, which is implementation, occurs when interventions or plan are actually carried out. So this includes reassessing the client. No? Before we implement an intervention, we have to reassess the patient. So we have already assessed the patient, yes, but we have to reassess it to check if it's correct with the baseline data that we have. So to make sure also if the intervention is still needed by the patient. So in implementation, we determine the nurse's needs for assistance. So it is important to explain, and during this implementation, it is very important to explain that what interventions will be done and what sensations to expect and what the client is expected to do and what the expected outcome. So during this implementation, we can also delegate tasks to different members of the team. Okay, so if the care has been delegated to other healthcare personnel, you as the nurse is responsible for the client's overall care. Okay, so during also your implementation, we do also documentation. If this intervention number 1 is done, yes or no. So if it's not, it is skipped. So why? Ano yung reason? Okay, so common in nursing interventions include pain management, preventing complications following a surgery, teaching and educating patients, and procedures that are part of nursing care. So this phase may be the longest or maybe the shortest, depending on what goal was established. So the phase may end longer or may end shorter or earlier. Okay, so now let's proceed to your last phase of nursing process, the evaluation. Okay, now the evaluation is the final phase of the nursing process. Here, the nurse measures the patient's progress towards the goals that were established in the planning phase. If the goals were reached or not, were achieved or not, if there were a new problems that came up during the implementation, if the patient is not satisfied with your care, these are just types of these are the things that you have to evaluate. So keep in mind that as a nurse carries out the planned interventions, he or she is constantly reassessing the patient, modifying diagnosis, and adding to the care plan along the way as needed. So during evaluation, so repeat, repeat, repeat. So during nursing intervention, during the evaluation, we reassess the patient. Okay, the goal was achieved. Okay, good. Now the goal was not achieved. Why? So look for the reasons. Okay, so we have to modify this one. We have to check this one. We have to go back because we didn't have enough data about this one. So it will repeat from the moment na the patient is doing good. Okay, so you will now look for another problems that may come up. Okay, so nursing process is every now and then. It's a cycle actually. It is every now. It is actually what do you call this, implemented every now and then. So it is not stopped. No, it can be stopped once the patient is or discharged, okay, or capable of returning to their to their own community. So the assessment or the nursing process will stop there. However, once they will go to their community, the community health nurses there will implement also the nursing process. So it's a cycle actually. It's a method that is used every now and then by nurses. So I think that ends my discussion for this unit 1. Again, please, if you have questions, clarifications, please do not hesitate to message or put a comment down below this YouTube link so that I can read your comments regarding the topic that we have discussed today. So that will be all. Thank you and assalamu alaikum warahmatullahi ta'ala wabarakatuh.